Well, let's now focus on the mental health aspect of these shootings. And the data shows that since 1982, well before the current political divide in this country, the overwhelming majority of mass shootings have been carried out by young men. For that, we're joined by Ziv Cohen. He's a clinical assistant professor of psychiatry at Weill Cornell Medical College. Good to have you with us, Ziv.
Good to be here.
Look, the statistics, as we said, since 1982, and even if you just look at the most recent spate of violence, it seems to be that the common denominator is young men.
Absolutely.
Why is that?
Well, it's long been known that young men are responsible for the greatest amount of violence of any group. So people have speculated on the reason for that, and most people argue that it has to do with high testosterone levels that lead to greater amounts of aggression in males in general, and particularly in younger males. And in fact, if you look at the curve of violent behavior in men, it really peters out over the age of 50.
What about the psychological aspect of the cultural environment, rather the sociological aspect? Because you have a lot of sociologists saying that regardless if the cause is pro-left, because, for example, the shooter in Dayton, we don't know what his motive is, but we do know that he was a supporter of Senator Warren and had far-left policies, or the El Paso shooter, regardless of their motives. It seems that overall, and perhaps not specifically with these two guys, there is an issue of young men that feel disenfranchised, that feel disconnected from society. And the argument has been made that more and more we are losing our sense of community because of the breakdown of institutions like church, for example, and community centers. What do you say to that?
I think that's true. I think that we live in a culture where we've gone from extended families and communities that were relatively cohesive to atomizing the individuals, where persons are really growing up. They spend most of the time in their own head, in their bedrooms by themselves, relating to computers or to technology. And I think that, for young men have a lot of aggression, and that's normal and even healthy. But what happens in a community is that the young men are trained to channel that aggression into more productive direction, whether that's sports, whether that's community, whether that's academic competition. And so I think that young men will always be at risk, if they're not within a cohesive community, to have their aggression go off the rails. And I think that's what we're seeing with these mass shootings. And in fact, we've seen it really for over the last 50 years, not just recently.
So when we talk about red flags and trying to figure out who could be at risk of doing this, I mean, for example, the Dayton shooter, he had a list in high school of people that he wanted to rape and kill. How do we determine who should go on a red flag list?
It's a very difficult decision to make. So most people who commit these mass shootings, what the research indicates is that they don't have a classic or typical mental illness that you would be able to treat with a medication, or that you would be able to hospitalize them for a week. Their symptoms are better, and now they're safe to go back into society. They have twisted, nefarious motives. They're bent on evil. They may have some soft signs of mental illness like narcissism or depression, but they also have a lot of alienation. They're not within a cohesive environment. And so there are so many people who fit that profile that you can't confine all of them. You can't put all of them on the list. And we don't have great tools right now for differentiating who's really going to act.
Okay, Ziv, thank you so much. Appreciate it.